Hello, everyone. Thank you so much for joining us today. My name is Jonathan Heller, and I'm delighted to welcome all of you to the second of our 4 webinars on advancing health equity in health departments. I'm coming to you from the Human Impact Partners offices in Oakland, California. I'll be the moderator and facilitator for today's call, and I'll also provide a brief overview of the Health Equity Guide, the resource we recently released that inspired this webinar series. I'll start by telling you who's hosting today, then we'll do a bit of housekeeping, and then we'll dive into our presentations. This webinar series is co-sponsored by our amazing colleagues at the Government Alliance on Race and Equity, aka GARE, the National Collaborative for Health Equity, and the Health Equity and Social Justice Committee of NACCHO. We appreciate all their contributions to this work. Our goal is to highlight inspiring examples of health departments that are transforming the way public health does its work to focus more explicitly on racial and health equity, and to provide concrete tips to others who want to do the same. As I mentioned, this is a 4-part webinar series. Each webinar focuses on a different component of the Health Equity Guide. If you haven't heard it already, you can watch the recording of our November webinar, Building Internal Infrastructure at Health Departments, by visiting the website healthequityguide.org. Today, our focus will be on working across government to advance health and racial equity. But before we get there, a little bit of housekeeping. We are recording today's session, and we'll share the recording and presentation slides with all registered participants. For folks on social media, we're also live tweeting the hour using the hashtag #BuildPowerForEquity with a number 4, #BuildPowerForEquity. We encourage you to add your key takeaways using the #BuildPowerForEquity hashtag as well. Okay. So today's webinar is listen only. That means that you can hear us, but we can't hear you. But that doesn't mean that today's event won't be interactive. We'll have 20 minutes for question and answer at the end of the webinar. And we're going to try something new as well. After the official webinar ends at the end of the hour, we're going to hang out for another 15 minutes until 11:15 Pacific, in case people want to stay on and ask additional questions, kind of like you would at the end of a conference session with hanging around and talking to the speakers. So anybody who wants to should plan on staying till 11:15. If you do have questions, please type your questions into the Q&A panel, and we'll use those as the basis for the discussion. The Q&A panel is located on the right side of your screen, and it can be toggled on and off by clicking the Q&A icon that you'll see on the top right of your screen or on a Mac on the bottom right of your screen. Before submitting your question, make sure all panelists is selected, and then you can use the Q&A panel to also let us know if you have any technical problems, and just make sure you hit the submit button as well. Okay. So our objectives for today's webinar are to describe why working across government is key to advancing health equity. We also want to highlight how Public Health Madison, Dane County in Wisconsin is working with other government agencies to apply racial equity tools and analyses to city and county programs, plans, and policies. We want to highlight how King County, Seattle established shared goals for equity across county government agencies. And we also want to highlight how GARE is helping health departments build government alliances and a shared understanding to advance racial equity. And last, we want to showcase the Health Equity Guide as a resource to help your health department. We have a fantastic lineup of speakers today. I'll do brief introductions before each presentation, but right now I just want to say thank you and welcome to Jordan Bingham, Matias Valenzuela, and Shona Devi. All right, so we want to bring all of you into this conversation now, and are going to do a couple of polls now and a couple of polls later on to get a sense of who's with us today and what your perspectives are. Please note that the poll will be on your right-hand side, on the right-hand side of your screen, and you may need to scroll down for both polls if you can't see all of the options. And then please make sure to hit the submit button once you've selected your options. So there are 2 questions. First, please let us know what type of organization you're primarily affiliated with. We know some folks may have multiple affiliations, but please pick the one that is strongest for you. And just to give you a sense, on our last webinar, about 45% of the roughly 700 people or groups who participated were affiliated with a local city or county health department. Another 17% were affiliated with the state health department and 2% with the federal health department. Let's see if we've got a similar breakdown today. And the second question we have as part of this poll is we want you to let us know how many people are in the room with you as you watch this webinar. We asked this question because we know on our last webinar, a number of folks were watching in a room with colleagues. Sometimes it was just 1 or 2 people, sometimes it's 3 or 5, and then we also heard that there were some groups of 10 or 30 or more. So we're curious how many of you are watching this webinar at this time. And then just to acknowledge again, we're recording this, and if you want to share this webinar with your colleagues, or if you miss anything, you can access that recording in an email that we'll send or on the website later on. All right, I'll show you the results in a minute so we can all see them. Let's take a look at the results, and please hit the submit button if you haven't already so that we can close the poll down. It'll take a little bit of time, but as we wait for the results, let me just say that we know that there are a lot of options listed, but we're really interested in getting a sense of the participants and their institutions. We talk a lot about health departments, but we know that others are interested in the content as well, and it would be great to know what feels relevant to them. On our last webinar, for example, 15% of participants were from nonprofits, and we assume that those folks are working closely with state and local health departments. So here you can see that, yes, we do have a pretty similar breakdown in terms of where folks are from. 48% are from local city or county health departments, another 16% from state health departments, just 1% from federal, 14% from nonprofit, and then some from university and as individuals and some others. And then in terms of how many people are watching with folks, you can see that about 62% are watching alone, 8% are watching with a couple other folks, and then we do have a few folks who are in a room with 16 to 20 people as well. So that's great, lots of folks watching. Okay, so with that, let's dive into the presentations. I'm going to start with a brief overview of the Health Equity Guide. Since we discussed this on the first webinar, I'm just going to do a brief recap and then talk more about why we work across government and why we need to focus explicitly on race. So first I'll introduce a tiny bit about Human Impact Partners. We're a national nonprofit working to transform policies and places. People need to live healthy lives by increasing the consideration of health and equity in decision making. Through research, advocacy, and capacity building, our vision is to bring the power of public health to movements and campaigns for a just society. Through our capacity building work with health departments, we saw that the field could benefit from a resource that highlighted effective practices to advance health equity and concrete examples of how that work was being accomplished. We conducted an environmental scan of health equity thought leaders and organizations and identified common themes that we called strategic practices for how health departments were advancing health equity. We also articulated the theory of change about how health departments need to use an inside-outside strategy to advance health equity. That theme, that theory of that inside-outside approach really highlights that we think that in order to advance equity, we need to focus on the social determinants of health, and then we need to look at the reasons why we have inequities in those social determinants. In our analysis, those inequities result from a power imbalance. Those who have inequities and are disenfranchised, while those who have power and benefit from inequity use racism and other forms of oppression to maintain that power. So then, as a health department, we need to address power and oppression, which requires this inside-outside strategy that I mentioned. So that theory of change and the strategic practices I mentioned became the framework for the Health Equity Guide, which grew to include case studies, actions, and resources. We worked with 20 advisors who guided the process, suggested case studies and resources, reviewed content, and were just amazing thought partners. So today we're going to focus on one aspect of what we have on the Health Equity Guide website, which is strategic practices to work across government. You see in the figure on the left, each of the columns represents a set of strategic practices within the guide, organized by this inside-outside approach. Within the working across government approach, there are 3 strategic practices: build government alliances, develop a shared analysis, and broaden regulatory scope. You can go visit the website to see full descriptions of each of those. But our Dane County, King County, and GARE presenters will describe how they advanced one or more of these practices in their presentations. We also want to note that the strategic practices in all 4 categories are interconnected and synergistic. So part of building government alliances may initially involve mobilizing data or research and result in building organizational capacity. Every health department is starting in a different place, in a different context, and with a different set of opportunities and challenges. So the Health Equity Guide doesn't offer a cookie-cutter or step-by-step approach, but rather an opportunity to see a range of strategic practices that health departments can take collectively towards advancing health equity. So after the call, we encourage you to dive more deeply into the Health Equity Guide to read about our theory of change, these practices and case studies, and get a sense of actions you can take and resources to help you. So before turning it over to our next speaker, I want to just emphasize why we work across government. As many of you know, there are many studies that show that over 50% of our health outcomes are determined by social, economic, and environmental conditions. At the same time, the Institute of Medicine in 1988 defined our role as public health agencies to be to collectively assure the conditions in which all people can be healthy. So those conditions, the conditions, social, economic, environmental conditions that we're responsible for and that determine over 50% of our health are usually governed by other agencies, those working on housing, transportation, criminal justice, et cetera. So to achieve our mission and to advance equity, we must work across government to spread our equity gospel and to change policies, practices, institutions, and systems with them. We need to work closely with schools, the planning department, Parks and Rec, Public Works, the district attorney, and many others who can help implement equitable policies and practices that improve health. From my perspective, the whole purpose of health and all policies is advancing equity and helping other agencies understand why inequities exist and what they can do about them. We need to get these other agencies on board or our progress is going to be limited. So last, I just want to highlight why we at HIP and many others believe that it's important to also be explicit, though not exclusive, about racism when we're doing health equity work. And I'm going to lift up 3 main reasons. First, it's because across health, housing, education, criminal justice, employment, and many other systems, in every jurisdiction and at every geographic scale, people of color in the U.S. are doing less well. Racism is baked into the creation and ongoing policies of our government, our media, and other institutions. Second, because racial inequities are found within all other dimensions of identity, whether it's income, gender, sexual orientation, or any other dimension, we need to understand race even when we're looking at these other inequities. For example, by income, low-income people of color are doing less well than low-income people who are white. So we need to take an intersectional approach. And third, from a very practical point of view, we think we need to be explicit about racism because racism is used as a political tool by those in power to maintain power. We will not win on equity if we don't address racism. Until we build bridges across communities that are facing inequities and that have been disenfranchised, we will not significantly advance our agenda. So even if you're working in a primarily white jurisdiction, you need to understand and help others understand how racism has been used politically to keep folks facing inequities divided. And you need to actively work to build bridges between people in your community and communities of color. There are other reasons to be explicit about racism, but those are our current top 3. And just to repeat and make sure everybody understands, we're saying we need to be explicit about racism, but that we also shouldn't be exclusive about it. Other inequities are hugely important, but we cannot not pay attention to racism. So with that as background, I'm excited to dive into our 2 case studies. First up, we have Jordan Bingham, who is the Health Equity Coordinator at Public Health Madison, Dane County in Wisconsin. Jordan has over a decade of experience as a partner, strategist, and facilitator in the areas of public health and racial justice. In addition to her work with Public Health Madison, Dane County, Jordan works locally and nationally as an independent consultant. In these roles and as a community member, she leads and supports initiatives aimed at advancing health, inclusion, and racial equity. So, Jordan, I'll turn it over to you.
Great. Thanks, Jonathan. Well, I'm really happy to be with you all today, and right off the bat, I think I'm going to out myself as a public health nerd because what a thrill to be connected with several hundred of us across the country in this shared learning. And so I'm a little bit giddy to be able to even just be a part of this community. So thanks for joining us today. And I want to just acknowledge and thank Jonathan and Human Impact Partners for their leadership, for all the work that's gone into creating the Health Equity Guide and these strategic practices, for leading and convening on Health Equity Awakened or Public Health Awakened, and just really to my co-presenters as well for being such great leaders in their own communities and building this national kind of tipping point toward health equity. So what I'm going to share with you today really is built on, I really am identifying as a spokesperson today because it's built on many years and decades of work in Madison and Dane County and in Public Health Madison, Dane County, our health department. So I'll try to give you a snapshot of what we've done over the past few years, which is really the work that I've been involved in. And since my topic today is about working across government, I'm going to focus mostly in our citywide and countywide racial equity and social justice work, but know that also within our own public health department, we've mirrored many of these same strategies and built a similar infrastructure to what I'm going to be talking about today. So sort of a two-pronged approach. And just a little bit of background on Madison and Dane County. We're the state capital. We're home to the largest university in the state. We're really known and we receive a lot of accolades as a destination, a wonderful place to live, work, learn, and play, and raise a family. And yet we are home to some of the deepest and most pervasive racialized inequities across health and any other indicator of well-being that you'll find anywhere in the country. And so we really need to hold ourselves accountable to, if we're going to be recognized as a great place to live and be, it needs to be true for everyone. So the slide that I have up in front of you represents the approach that we've taken in setting up our racial equity and social justice initiative. And this is a citywide initiative. I'm going to mostly focus on what we've done in the city of Madison as a government entity, but know that Dane County, our county government, has taken a very similar approach and in fact has even set up an Office of Equity and Inclusion. I just haven't been as involved in that work, and so I don't have quite as much to say about it in specificity. So I want to acknowledge that this is the model from the Government Alliance on Race and Equity, and I know Shona Devi, my colleague from GARE, is also going to be talking about this model too. So I'll try not to spend too much time with this, but just to illustrate that this is the approach that we've taken. So normalize, organize, operationalize, normalize being really setting racial equity as a priority, getting staff and leadership and elected officials trained, establishing baselines from which to move forward and measure our progress, and getting organized with our data. And so, and even passing some policies stating citywide that racial equity is a priority for us. Organize really is creating the structure in the form of teams, an interdepartmental team with leadership and representation from all city agencies. And then operationalize, and also making sure to look at our community partnerships, and I'll say a little bit more about that later. And then operationalizing is putting it into action by using racial equity tools in our decisions and in our policies and practices, developing racial equity action plans, and again, using data and evaluation to hold ourselves accountable and measure progress. And the links are there for more information on our work. Why we think this is important, Public Health Madison and Dane County, and just to back up for a second, and I mentioned working in city and county government, we're a merged agency, so we're a city-county health department, so we get the pleasure of working with both city and county government. And the reason that we think it's important to work across government to advance health and racial equity is, as you can see there, we can't do it alone. When we take a health equity approach and we start talking about the social determinants of health and those upstream causes, we're talking about those areas that Jonathan mentioned: housing, transportation, education, access to employment. Those are areas that the public health department doesn't necessarily work as directly in as a lot of other government agencies and outside partners as well. And so if we are serious about this, we have to work with those and build partnerships with those agencies that are working in those areas that we think have huge impacts on the health of our community. Secondly, to acknowledge and reconcile with government's history in creating health inequity. So in public health and in government in general, we've been complicit at best in creating, perpetuating, or sometimes ignoring racial inequity, and so much of the way that we do business in government is, are vestiges of systems and ways of operating that were created decades and, in some cases centuries ago. So we've got to acknowledge and be able to undo some of those deeply entrenched systems. Third, traditional approaches aren't moving the needle. Racialized inequities in some cases are getting worse. Even as overall health improves, if we pull apart the data, often inequities are getting worse. And so we know that race-neutral approaches aren't working and that some of our traditional models of service aren't quite moving the needle in the way that they need to be. And then lastly, there's a lot of conversation about demographic change and population change, and I believe that our future depends on it. I live in a community where, we're still a majority white community, and yet our Madison public school system is majority kids of color. And so if we want to be a place where really families and individuals can thrive and where we can continue growing and being viable in our social and economic fabric, I really think that our future depends on taking a new approach. And then just to give a brief look at some of the impacts of our work, the City of Madison's Racial Equity and Social Justice Initiative started in 2013. As I said, we've created a team that at this point every city agency is represented. We've hired a citywide racial equity coordinator who works in our Department of Civil Rights and have really made a lot of progress in a number of different areas. So going back to that normalized, organized, operationalized framework, we've built a shared understanding. We've got shared definitions of what we're actually talking about, what our goals are, what we're trying to accomplish. We've trained a number of city employees now. I think the number is now between 300 and 400. It may even be higher than that out of the workforce of about 3,000. We've focused on frontline level staff as well as department and division heads and elected officials, making sure that, we're not just setting this as a priority without making sure folks have the skills to accomplish the work. We've created some baseline assessments, and so we've got data to not only set goals, but to measure our progress. So the city conducted a survey of employees of color. That was a workplace culture survey that was, maybe some people were surprised by it, but certainly told a story of a different experience that our employees of color have at the city. We also have done a lot of baseline assessments in public health and understanding not only that our workplace culture and staff experience, but our readiness to pursue health equity approaches. So acknowledging, where we need to improve, and then also having direct conversations and just normalizing being able to talk about race and equity and what that means. On the organized front, we are seeing some promising progress toward a more diverse workforce at all levels. And so both within recruitment, hiring, and promotion, we are starting to see hints of a more diverse workforce, and we still have a lot of work to do there. Have created a collaborative leadership model, so this team model where every department is represented. We've established work groups based on subject areas, and so instead of the traditional hierarchical model of government, which still exists, we're creating opportunities for people to lead in a lot of different ways on a lot of different subject areas. This next one I think is really important, different and deeper partnerships. And really, if that's the only thing you take away from what I said, is just rethinking who we collaborate with, who we partner with, both across government, finding those shared interests, and then also within the community partnerships too. So more intentional relationship building with those organizations and agencies that share our interests, where we have some work in common, and with a focus on, in the community, people of color-led organizations, and having some of their work direct what we do and being more behind the scenes at times. And then lastly, operationalizing. Racial equity tools are being used widely, not only in the public health department, but across city government, and have actually had an impact in different shifting the way that decisions are made, everything from hiring to budget to public works projects to housing, public participation, and cities taking a look at, how do people engage with government, and I know you'll get into that with some of the other presenters, but that's really important to us. And then really shifting the way that we operate, and so seeing some of the things that I mentioned before with different ways of having community drive our decision making, how we outreach with community partners, and really just shifting the way that we do our day-to-day business. And we've got many examples that I could share with that if folks want some more concrete information with that. And I think the last thing that I would say is that, if you're just getting started or you feel stuck or not sure what to do next, one thing you could do is invest in even in taking the idea of investing in a really expansive definition, even if it's an investment in time, in doing a baseline assessment, finding out where you are. There are a number of tools out there that can be used for that. Getting staff and leadership trained in that normalizing piece. I can't overstate how important that continued learning journey is. And then taking that look at your current and future partnerships as well. And, even if that seems like a big lift, I think even just having a conversation with somebody in another government agency who works in an area that you think you might have some shared interest in, whether it's transportation or housing or one of those other areas that have been mentioned. So I'm going to stop there and look forward to your questions, and we'll hand off now to Matias. Thanks, everyone.
Thank you, Jordan. That was amazing. You guys are doing amazing work in Madison. Thanks so much. So before going over to Matias, just want to remind everybody that if you have questions for Jordan based on what you just heard, we've got some questions coming in, but feel free to use the Q&A panel at any time. And I'm seeing a few questions, and just to remind folks that we are recording this session, and we will have the slides and the recording available for everyone. Okay, so I'm now really happy to introduce Matias Valenzuela, Director of King County's Office of Equity and Social Justice. Matias has been at King County for more than 16 years, including in public health and leading the county's equity work. Early in his career, he worked as a journalist in the United States and Central America. He was a Fulbright professor in Nicaragua, and he is an affiliate assistant professor at the University of Washington School of Public Health and Community Medicine. Welcome, Matias.
Thank you. Thank you for having me on the webinar, and for everybody who's listening in and participating. And I think, as it was just said, my background is heavily in public health. I worked in our public health at King County for about 14 years and was very involved in the launch of our initiative, but now the work has been elevated. There's a separate Office of Equity and Social Justice within the office of our King County executive, Dow Constantine, and my position now is a cabinet level position, and I think it's a bit of a tribute to how this has grown and how it's a priority. But I think the basis of what we're going to be talking about now today is that it is the influence and the history and the basis and frameworks from public health are extremely important, and important to other departments and agencies too here in King County. So just briefly in terms of the background, and as I said, in 2008, it did begin with the executive asking public health to lead and coordinate this effort that would involve other departments. And we really used a framework which I think is important of the social determinants of health, so the social, physical, economic conditions that allow everybody to thrive. But we really kind of strategically began to call them the determinants of equity. And this was an early effort for us to actually have this see like it wasn't something led by the health department, but it was part of everybody's work. So people in transportation, people in parks, people in the criminal justice system could see themselves reflected in this. And then since then, we've done a few key things like passing an ordinance in 2010, establishing an Equity and Social Justice Office, and creating this last year an Equity and Social Justice Strategic Plan that really all have helped together to really kind of follow some of the efforts that was being talked about before around kind of normalize and organize, et cetera, in terms of making this law and making it also, since it is an ordinance, it applies not only to the executive branch, but applies to all the other agencies. So like things like, and separately elected as well, so council and our elections and assessors and sheriff, everybody else who's under this umbrella. The offices allows us to have some resources and staffing, and the strategic plan is really a roadmap for our work, both internally and externally. I'm going to go next slide. So, and really why, in terms of the driver for this work, is actually what I've been talking about, is really improve those conditions and the determinants of equity. And our work, that has kind of the theme of the webinar today, has expanded to be very inclusive. One of the key drivers now is that we're leading with racial justice. I think we have since we launched the initiative almost 10 years ago now, we have actually seen some disproportionality in some areas, such as the criminal justice system, get worse. We've, for example, reduced the number of youth incarcerated, but overall the disproportionality for many years has gotten worse. So what that has told us is that we actually had to be more explicit around racial justice and the racial component. So the new strategic plan as of last year has this very front and center in terms of us leading with racial justice and having our executive and other leaders kind of talk about this and lead with this. Very powerful to have, especially some, our white leaders carrying that message. So we have a 6-year Equity and Social Justice Strategic Plan that cuts across all departments and agencies. There's 4 strategies that you see here, which starts with King County Invests, and then in those areas. But I think that just pointing out the fact when we talk about invests, it's really about shifting power and resources to focus on these areas, and using both some of the existing resources and any new potentially funding sources to really align with this effort. So really focusing upstream and where needs are greatest, investing in community partnerships, so moving beyond sometimes often these episodic relationships to more strengthened relationships that actually have resources behind them. Investing in employees, especially those employees that have that are lower in kind of the hierarchy here in terms of pay and other things, because that's where we tend to have more of our employees of color, but also the employees that have least amount of opportunities to advance, to grow, and also through our surveys, and we have a lot of equity questions in our King County Employee Survey. We know that the ones that are feel least respected, feel least value in the workplace. So we are 14,000 employees. So really having a focus on those individuals and developing pipelines and making sure that they have opportunities to thrive, and professional development opportunities are key. And doing this with transparent and accountable leadership. When we developed our plan, we engaged about 700 of our employees. We've talked to over 100 community organizations, and what we heard both internally and externally was that one is that we needed to track and show the work that we're doing, and we're going to be doing some public reporting now based on the plan overall for the county, but also by each department. So we're going to be showing how everybody is doing. And there are other elements too in terms of this strategy, in terms of we heard a lot of really having make sure that we walk the talk, that there's consistency in terms of what we're saying and what we're actually doing, and I think we have a lot of work there. So these strategies are drive across our various parts of our plan, we have goal areas. We have a policy agenda. We have regional work and collaboration that we're doing. I think the heavy lifting and how we're getting really our house in order is through those 6 goal areas. So, for example, one of them is workforce workplace or leadership operation services, community partnerships, policies, plans, and budgets. Around the workforce workplace goal area, we have very specific goals around racial diversity and racially diversifying our leadership positions and management positions, which we're tracking now, and we've actually already, just in the first quarters that we've been seeing, we've actually already are seeing some changes in that and some improvements, which is exciting to see. Issues around workplace culture, employee development, and in each of these goals, we actually have measures and we have some minimum standards. And I think to the theme of the slide about working across government is that we're holding all departments and agencies accountable to this. So it's great to see sometimes, for example, the commission that oversees the sheriff's office, as an example, bringing up our plan and seeing, okay, how is the sheriff's office responding and moving the needle in some of these measures. In terms of the impacts, I'm just focusing here more on the community, because at the end, a lot of internal work, but also is extremely important, is the difference that we're having in people's lives. And these are, we have 8 pro-equity policy agenda areas. And then a regional collaborative work that we're doing collaboratively with other partners. And this has been, using those strategies has been great to be able to move some areas of the county. For example, our information technology areas, and it's released our IT department that had been generally more internally focused on saying, okay, now that we have a strategic plan, they need to be thinking about how do you invest in community partnerships. So actually having our IT departments begin to think about how the digital divide that exists. So those are kind of some of the, and now we have our information technology and digital equity as part of our policy agenda. So it's been interesting to see how some of the departments have embraced this. Also in the justice system, there's a vision of 0 youth detention, and a lot of important work happening around that. And the regional collaborative that's part of this is also an acknowledgement that we have convened a number of different tables with the acknowledgement that we can't, as King County government, can't move, make the changes we need to see alone, and we actually have to work with other partners. So one of the things I do is convene our local, we have 39 cities in King County, including Seattle being the biggest one, and they have excellent racial equity work. But there are a lot of other ones that are just getting started and are even struggling and don't have capacity. And we've, as a regional government, county government, have been convening about 24 of our cities actually create, and most of them aren't in the racial equity arena yet, but they are, beginning to get into the space of diversity and inclusion, and really supporting them. And then also establishing some other tables in which we're very explicitly actually focusing on structural racism around some key, with some key partners around education and higher education, with philanthropy, with some community-based organizations as well. So in terms of what health departments, and I think what they bring in to this conversation that could be really useful into some kind of maybe parting recommendations. I think first, if you look at the images there, and one is of the Seattle skyline, and I think what was said about Madison resonates for us here in the Seattle King County area too, in the sense that there's a vision that people are often doing quite well, but we have deep inequities. We have some of the wealthiest, richest, and basically in white neighborhoods that are among the wealthiest and healthiest in the world, and yet we have communities that have continued to fall behind. So our gaps are quite huge and getting worse in many areas. And I think for us, the whole how we deploy this and how we talk about and engage people around kind of race equity and using this framework of both race and place for us has been extremely important. and showing the link that exists there. We do have some areas that are more rural in the eastern part of the county, in which heavily white, and I think in places like there where they still have very significant inequities. So being able to actually lead there and talk with electeds there and with others around more the place, and even among the white population, how their inequities, I think, can become a, and they have challenges such as around affordable housing, can be a great entryway to the broader conversation and eventually get to issues of race. Also, I think that for us, very early on, too, is using data to tell the story was extremely important, and it's really important to realize that public health departments have some capacity in terms of data that a lot of other departments and agencies don't have, and I think modeling that and sharing some of the work around that with other departments, agencies, and government are key, and especially data for us in making the case. I mean, we're 10 years in, but I think it played a huge role early on, especially on some of those more challenging and resistant audiences. And probably my final point that I'll make too is actually moving beyond kind of how do you use health in terms of your in your language, and often when you kind of lead with health, folks think it's not about them. So if you're in the transportation planning area, for example, and planning bus routes, if you lead and say, hey, well, this is about health, they're less likely to really think that it's about their work. So really, we've been really thoughtful about how we actually strategically use that. And instead, for example, of using things such as health and health policies, thinking about, let's think about equity and racial equity in our policies. So thank you.
Great. Thank you, Matias. That was amazing. You guys are doing fabulous work up there, and we've looked to you as a model for many, many years. Again, if people have questions, they should type them into the Q&A panel. I want to do a quick poll. We're running a little bit behind. I want to leave some time for questions. But before we move over to Shona, let's do this poll. These questions are for everyone who works for or with a health department. For those who work in nonprofits or academia or as consultants but work with a health department, you can reply based on your assessment of the health department that you work with. So first, we want you to rate how advanced your health department is with respect to working across government to advance health equity. Where are you in the life course? Are you an infant, or are you a wise elder, or somewhere in between? Second, on the right side, the question is, based on the strategic practices that are listed, which do you think is the most developed practice at your health department? Please choose the best option for you, and then remember to hit the submit button, and I will show the results. So maybe people could do that quickly, and we can keep going. Remember, you might need to scroll down to see all the options. From our last webinar, we know that some folks were participating from federally qualified health centers or hospitals outside the health department. If you work with these institutions but collaborate with the health department in some way, you can feel free to submit your opinion based on the health department's readiness to advance health equity by working across government. If you didn't hit submit already, please go ahead and do so, and we can close down the poll, and we can look at the results as soon as they come up. Take a couple seconds. We know from our first webinar looking at the building internal infrastructure kinds of strategic practices, 39% folks said that their department was in their infancy, 44% said they were preteen, only 1% said they were wise elders. So here you can see the results a little bit more advanced in this case, it looks like. So about 30% in infancy, 35% preteen, 13% adult, 1% wise elder, and the rest don't know or not applicable. And in terms of which of the three strategic practices people feel like they're most advanced at, about 34% felt like they're so far most advanced at building government alliances, 17% are advanced at developing a shared analysis, and only 2% said that they're advanced at broadening the regulatory scope of what public health does. Great. Okay, so we're now going to shift to our last speaker, and I'm honored to introduce Shona Devi. Shona is the South and East Regional Project Manager for the Government Alliance on Race and Equity, or GARE, which recently merged with the organization Race Forward. Prior to her work at GARE, Shona led efforts to develop strategic relationships, implement internal operations, and contribute to strategy development in healthy communities for the Robert Wood Johnson Foundation. Shona has also worked as the founder and executive director of Alignment Jackson, director of United Way's Capital Area Education Initiative, and as a community organizer and lobbyist with the ACLU of Mississippi. We asked Shona to briefly introduce GARE, reflect on the case studies and on GARE's national work, which supports agencies working across government to advance health and racial equity, and share advice or lessons learned. Welcome, Shona.
Thanks so much. I'm really happy to be with you all today, coming to you from Atlanta, Georgia, which apparently now is a place that gets snow. Really excited to be with you all and want to share a little bit about the Government Alliance on Race and Equity. So we are a joint project of the Center for Social Inclusion and the New Race Forward and the Haas Institute for a Fair and Inclusive Society. GARE is a membership network of state and local jurisdictions that are committed to achieving racial equity and improving outcomes for all. We've grown quite a bit over the last year. We've gone from 22 members to 59 members. We're working in over 150 cities and in 30 states across the country, and we really focus on the application of theory. So many jurisdictions are committed to this work but don't know where to start or how to integrate racial equity into their day-to-day, and we're really sort of working in the space of helping to provide tools and technical assistance that help jurisdictions to do just that. So you might be wondering, why focus on government when it comes to racial equity? Well, the history of government and racism can be told in 3 phases. The first phase is really where government is explicit about its racial oppression. Government passed and enforced laws that determined who could vote, who could be a citizen, who could own property, who was property, whose land was whose. And fortunately, we had the passage of the 13th, 14th, and 15th constitutional amendments, the 19th Amendment, the passage of the Civil Rights Act and the Voting Rights Act. And this really came from people working in coalition to change the laws in our country. We moved from a place of explicit racial policies to implicit policies, that still had an impact on the outcomes for people of color, but no longer explicitly discriminated. And we've moved now into an era where people in government are making efforts to transform it from the inside. We call this the GARE era, where we have a network of government entities that are applying a racial equity analysis to their work to improve outcomes for all people. So just a few reflections in listening to Jordan and Matias. One of the things that I wanted to point out is that GARE really does support its members through both subject area groups as well as regional groups. So we have regional groups based in the South, in the Midwest, in the West, in the Northeast, as well as subject area groups. And I have the honor of serving on the subject area group that focuses on public health with Jordan. We have supported health departments in a number of ways, including both around communication, so helping public health departments think about how do they communicate about race, and then also in using a racial equity tool to operationalize this work. We think that policy is really important and key, but we know that without good implementation of policies and practices, we won't achieve those goals. We also wanted to just point out that Jordan and Matias indicated a couple of really important key pieces. The hiring of equity and inclusion officers. We've seen that work really well across departments across the country. The training of staff, extremely key. And we've also been supporting districts in the collection of data, including those baseline assessments. And then finally, some of the advice or lessons learned. Jordan mentioned earlier the normalized, organized, operationalized framework that GARE uses to help jurisdictions think about this work. And within normalized, we really think that shared language is absolutely imperative. And shared language is really about gaining a deeper understanding. Operationalized, here is where infrastructure is really key. If you don't have folks across every department and also from senior leadership to frontline staff working on racial equity, it'll be difficult to move and achieve those goals. So we've seen where departments have been really successful is when they've had folks at the table across different divisions as well as from different parts of leadership. Wanted to point out something that Matias mentioned around workforce equity. There are 3 areas that we tend to encourage jurisdictions to focus on because they impact just about every department within local government, and that includes community engagement, workforce equity, and contracts and procurement. And then finally, organizing. A lot of times jurisdictions have trouble thinking about how do you get started. And we have been able to help folks think through what those entry points are and who should initiate the conversation. And it really depends. In some cases, the conversation was initiated by community members who brought it to government officials. In other cases, and in many cases, the health department has actually been the first to sort of start the conversation. And so with that, I'll turn it back over.
Thank you. That was awesome, Shona. Really nice summary of a lot of what folks were saying. As you heard, all 3 of our participant organizations are doing really amazing work and have done a great job highlighting why a focus on working across government to advance health equity is really important. So we'll have time for a couple questions now, and as I said, we'll have another 15 minutes after the hour, so we'll do a couple questions now and come back to that. If you have questions, feel free to put them in the Q&A box. So we've got a bunch of really good questions. I'll start with this one. Somebody says, I agree that you cannot address health equity without addressing racism, but how do you get policymakers to realize this when they insist that speaking about racism is divisive? They want to be race neutral. So anyone of you want to pick that one up?
This is Shona, Jonathan. That is such a great question, and it's a question that we get all the time. And in fact, we've done some message testing, and we've learned and have a report on the Center for Social Inclusion's website as well as racialequityalliance.org that talks about leading with race in communications. And in fact, when we don't talk about race, we're implicitly all thinking about it, and we can further damage the opportunity to communicate. And so would just point folks to those resources, and we'd love to have more conversation with you offline.
That's great. Let's just keep going. Maybe we can fit in a couple more questions. Jordan, a couple of folks have asked specifically about organizational assessment tools and other things that you mentioned in your talk. Do you want to give some websites out for those?
I would, yeah. So the BARHI, the Bay Area Regional Health and Equities Initiative, and it's just BARHII.org. They've created a toolkit for local health departments to advance racial equity, and it includes some really wonderful assessment tools. And so we modified a staff survey as well as management interview and focus group questions and have used those as our baseline assessment. I will say that with that, we have been working with an external evaluator from the University of Wisconsin-Madison, that's from the Population Health Institute, and we think it's important, if at all possible, to have outside evaluation. It's really hard to evaluate yourself from the inside, but I would start with BARHI. Another tool that you might look at is Multnomah County's Equity and Empowerment Lens, which has a baseline readiness assessment as well that I believe was modified and based on the Barhai tools and includes a little bit more of a race explicit focus. And then trying to think, there was, and then really along the way we've used tools that have been available from GARE. So if you go on GARE's website, racialequityalliance.org, you can find some really effective toolkits there as well.
That's great. Thanks, Jordan. Matias, I'll throw this your way. Do you have strategies to manage internal resistance when trying to implement racial equity initiatives in government?
Yeah, I mean, I think one of the things, a lot has been said even around, training, and I have to say we have done a good amount of trainings. We've trained thousands of our employees with, usually it's been a smaller or shorter, maybe half-day training on basic equity and social justice. Then we do a full day on race, power, and illusion, and then another half day on applying. But it's been some of our folks haven't gotten through all the training. So one of the things that we have really realized that getting leadership managers and supervisors on board is key. And what we are doing now is actually doing very large sessions, actually a couple hundred of our managers and supervisors at a time on subsequent months to do full day training. So it's actually 3-day training, really getting into the very deep learning and integrating and application of what this means, and that it's beyond just a very kind of superficial, transactional thing of having, work plan with an equity measure, and it's really about a deep lens change. So really doing that and pushing it with our managers and supervisors and getting all of them trained. That's what we're trying to do now, actually. Just in this year, we're going to get about 700 of our managers and supervisors in 3 full-day trainings with a lot of work in between. And then really training them on how to actually strategically work around this when there is resistance. Because I see my job is supporting others so they can actually do the work. So how do they begin to even move beyond kind of just work as folks often do in their workplace of working individually and doing in their silos, but actually this is, as has been kind of referenced, organizing work within your within your spheres and your sphere of influence and how you're trying to move this work. So really getting people very familiar with how they would handle challenges or move things and challenge particular dominant ways of doing things, and getting very much in the nitty-gritty, I think for us is starting to have some real results, and it's quite much more transformative for our employees. So I guess kind of a short response to your question is just we've responded to the resistance by just going deeper. And then the other thing is I think having a framework and having it as a law like we have an ordinance sends a really strong signal. And more people, and we see this also through our employee surveys and other things, they're actually coming to King County government to work because we are doing this equity work. So when they come in, this is something that they expect. And it's the mandate from our, and it's law. So I think we also are not catering to the lowest denominators in the resistance. We actually are pushing ahead, and my executive wants this to be a priority and wants us to push. So people have to, catch up or, in a way, get out.
Great. Okay. Thank you, Matias. Okay, so we're getting a bunch of questions. The next question I'm going to take, but I'm going to close out for people who have to leave at 11 Pacific. The next question I want to address is how do you do this work in a rural context and a primarily white context? We're getting several questions along those lines. So that's just a teaser to get you to stay on for a little bit longer. But before we do that, just to close out for people who have to leave, we want to, again, thank our partners and co-sponsors for the webinar, the Government Alliance on Race and Equity, the National Collaborative on Health Equity, and NACCHO's Health Equity and Social Justice Committee. We also really appreciate the California Endowment for providing funding to help develop that Health Equity Guide and for this webinar series. And thanks to all of you for joining us as well. We had close to 600 groups, people or groups join us today, so it's a large number. It's great to see this enthusiasm. A reminder that there are 2 more webinars that are coming up. Our next one will be with folks from Alameda County and Kansas City, Missouri about fostering community partnerships, and that'll be in January. And then in February, we'll hear from folks in Omaha, Nebraska, and in Minnesota about their work to champion transformative change. Please sign up for those. Just because you're signed up for this webinar doesn't mean you're going to be signed up for those. You have to sign up for each of them individually. Also to note that we're going to send you a 3-minute evaluation to complete after the webinar. Just please take those 3 minutes to complete it so we can make any adjustments for the future, and be on the lookout for the slides and the recording as well. And then last, we just hope you dive into the Health Equity Guide and find that it's a resource for your work. If there's anything else that you see that would be useful when you look at the guide, please send us feedback. We'd love to hear from you. So again, thanks everyone for joining, and hang on for another 15 minutes of Q&A if you can, and hopefully we'll see you again in January at the webinar. Okay, so a bunch of folks are probably going to log off, but for those who want to stay on, we'll do some additional Q&A for another 15 minutes. If your question hasn't been answered yet, feel free to go ahead and submit it again. But I do want to start with this question about what do folks in mostly white areas or rural areas do. Just some examples of questions we're getting. Do you have any specific strategies for how to influence a county that is 87% white with a county workforce that is representative to take health and racial equity seriously? And then there was another question about how do you do this work in a rural setting? So I don't know, Jordan, Shona, Matias, anyone want to start on that?
This is Jordan. I can address it, and I'll be brief so others can chime in. So Madison and Dane County is predominantly white still. I mentioned a little bit about our demographic change, and you know, we have clear and present issues of racial inequity, and it really has been centered in the conversation over the past several years in our community. And so, you know, I don't know that we necessarily have to make that case all the time. We maybe by person we do more so than at an institutional level, but I do, you know, network with others in other communities around Wisconsin. I grew up in a really small town in southern Indiana, so have a lot of firsthand experience around this. And it was just actually in a conversation with a friend of mine who is still living in that community in Indiana and teaching and experiencing some really troubling things around just people having a hard time accepting change, understanding change. And so I think, you know, it sounds really corny, but, you know, having dialogue with people, and I think for those of us who are white, you know, modeling being comfortable talking about race and addressing difficult, challenging questions with especially white folks with power who are resistant. I think often we've relied on people of color and communities of color and organizations of color to do that, and sometimes that really needs to fall on us because it's a lot of work and it's a big lift and can be really harmful for folks of color to have to continue to do that. So I think that, you know, we do have to take some responsibility for that. I think that, you know, even in communities that are really predominantly white, even if, you know, there's a really low percentage of, you know, statistically of people of color there, they're still there, and chances are, you know, their experience may be even worse than if the numbers were greater. And so they, you know, just in terms of people feeling erased and not present and not acknowledged in their community. And so I think it almost, you know, is even more of a case. To be talking about race and advancing racial equity. And then the last thing I'll say is that if you look across the country at areas where population growth and economic growth are happening, they're almost without exception areas where racial diversity is increasing, and folks are population growth is attributable to the communities of color. And so, you know, if you want to have a conversation with folks in your community about what kind of community do we want to be today, in 10 years, and in 20 years, you know, we've got to start to shift some things, and this really has to be a place where everybody can live and thrive.
Great. Shona or Matias, do you want to add anything quickly?
Sure. I'd just say, I mean, in our ordinance, we call out low-income communities, communities of color, and immigrant refugees. So we have a kind of it's broader than that regard. And even when we look at, we're all also majority white still, and also most of the people who are poor in our country in our county are white as well. Part of it is actually how do you engage them, because we have some rural areas in our county too, and how do you look at that information, tell the story too, and about the inequities that exist, even among the white population. I think is extremely important. We have, for example, a trend of some differences in terms of folks who've been in particular rural areas for a long time versus some people have come in now from the IT sector and are at a whole other level. And so we have huge differences there. And then how do we use some of those kind of entry points as a way to then get into issues of race and racism and talking about the racial component, because similar to Madison, it's a growing part of our population, and within approximately 15 years we are going to be majority people of color, minority, right? And so it's something that we need to get ahead of and get us all thinking about.
Great. Okay, let me move on to
Shona.
Oh yeah, go ahead, Shona.
Just wanted to say really quickly, for those that are in rural areas, GARE does work with small counties and towns, and one of the things that I would just sort of implore is to think about all of the assets of being in a rural community. You are most likely a few degrees of separation away from decision makers, so you don't have to go through, 6 people to get to a decision maker. You can find them at the grocery store in many cases. The other thing is that you may have fewer levels of bureaucracy. There may not be as many people that have to sign off in order for you to move something forward. It still may be very difficult, but there may be fewer levels of bureaucracy. So starting with that frame of, what do we have working for us and how can we use that to leverage what we want to get done. In terms of those communities that may be predominantly white, I'd really encourage you to disaggregate your data by race, and not just non-white and white, but actual disaggregated data by census race descriptions. And then help people to think about how are they all interconnected, and pose the question of what is your vision for the Department of Health, and what are your goals, and can you reach those goals and that vision without improving the health outcomes of people of color?
Thanks, Shona. And I'll just repeat and build off of what folks have said. Racism is something that white folks created, and so white folks need to be part of the solution, and we're not going to get to equity unless we build bridges across communities. So everybody needs to understand that our fates are really linked. So thanks for all your reflections on that. I'm going to move on to another question. How is success measured? What indicators and outcomes? And I would say specifically around this work across government, how do you measure success? How do you know you've been successful in working across government? Anybody want to pick that one up?
I would love to take that one. So this can be a really scary answer for people. It's when we have closed the gaps and improved outcomes for everyone. And that can be extremely scary to say that we're actually going to hold ourselves accountable for different outcomes than what we currently have. But that's absolutely what we mean when we say we want to be successful at advancing and achieving racial equity. It's improved outcomes across all areas.
Great. Something going to add to that? No. Okay.
I would just say, I mean, our plan is full of measures, and I think that's what we are ultimately holding ourselves accountable for. But what really doesn't go into the plans is the deep, I think, cultural work and organizational work that needs to happen. And that's very context specific. And for us, every program, every department, every agency is going to have its own approach. So I think big picture measures and the data is extremely important in those outcomes. But then there's all the other work that needs to happen to make that possible. And even though we have a theory of change, every again, all the cultures are so different that we need to have very specific approaches based on where you are.
Great. Okay.
Yeah, and I would echo everything that's already been said, and I would just add that we intentionally did a pretty expansive baseline assessment, organizational assessment, so that we would have something to measure against. So we've got internal measures, and then also, as others have alluded, we're tracking data and outcomes as well.
Great. Okay. So I'm going to combine a couple questions that I'm seeing. There's a couple questions around, you know, along the lines of my organization's primarily white. How do I convince them? How do I shift that without just waiting for people to retire? Is there some way to do that? Not exactly the same, but there are questions specifically about how do you bring a racial equity lens to contracts and procurement. So those are two very specific things. Anybody want to take one of those or both of those on?
I can start with, oh, go ahead.
That's right. Well, I'll just say, I mean, really quickly in terms of convincing white folks, that's where, I mean, we do a lot of effort in building champs and trainers or whatever it may be that are white, so leaders around this work who are white. So it's not, you know, people often look to folks of color to be the, you know, carrying the message, but I think it's so important to have those leaders, I mean, including our executive who is white, but people at in all departments, all agencies, delivering the trainings, delivering, you know, the message and being the ones to speak up and training them on just even methods and ways of how they can actually interrupt some of the processes so we actually begin to get different results.
So in other words, white folks can be champions of this change even if you don't have people in color in those positions, right?
They have to be champions.
Right.
It's not an option. We're not going to make it. This is not about work that is happening with communities of color. We need primarily to focus on white folks, white culture, and what has been happening in our systems created by white people to kind of create these outcomes. Yeah.
Thanks. And Shona, were you going to add something?
Yeah, so I would just say that, you know, building relationships is really critical, making sure that you're building multiracial coalitions, as Matias indicated, and identifying those champions and just starting with conversations. We've got a lot of tools on the racialequityalliance.org website that can help folks with that. And then on contracts and procurement, just really quickly, this is an area that we've seen a lot of cities, counties, towns do some work on, both from the contract side where they're thinking about how many of our contracts are going to minority and women-owned businesses. Are there opportunities for subcontractors to be a part of a process maybe where there's a larger sort of overall contractor that may be providing the bond, may be bonded, and that way the subcontractors who in some communities, people of color that are coming in as subcontractors may not have the ability to be bonded. And so if you can separate and create some additional subcontracts where folks can come in and do that work without having to be part of a larger contract, and that can be really helpful, as well as working with large contractors that are not requiring subcontractors to be bonded because they are already providing that level of security.
That's great. Thanks, Shona. I'll just weigh in that if you look in the Health Equity Guide, you can see the case studies there, and there are resources with other concrete examples of how different departments have measured success and done these various things that some folks are asking about. So check out the case studies on the Health Equity Guide website. And also just know that we created some new PDFs that are now downloadable. And there's a download section of the website that indicates how folks can get started. I am going to end with that theme. Somebody is asking for 3 concrete strategies to implement immediately. And so maybe that can be the last question we take, maybe one each. You guys have a concrete strategy that folks might be able to implement immediately. guys got all quiet.
I'll just say just getting your leadership on board, because if you don't do that, it becomes kind of crazy making. It's just very challenging, and we've all been there and been doing the work when leadership is not on board. So there's trainings, there are all different things. So kind of strategizing around that is key.
Great.
And I would say start with normalizing conversations around race, and that can be by showing race the power of an illusion at lunchtime with coworkers, or it can be sharing an article that you all come to the table and discuss together. But start with normalizing conversations around race.
Great. Jordan?
Yeah, and this is Jordan. I would just go back to the idea of find someone in another agency in government whose work overlaps with yours in some way and have coffee with them. So a planner, somebody in community or economic development, transportation, housing, one of those areas.
Awesome. Those are great suggestions. Okay, it is now 11:16. We need to wrap up. We received a bunch of other questions, and I'm sorry that we couldn't get to them all. You should know that we are going to compile a list of the top 10 questions asked during the webinar series, and we'll post those at the end of the series on the healthequityguide.org website. So once again, I just want to really thank Jordan, Matias, and Shona for sharing their wisdom and all their insights. You guys had great answers to so many of these questions, and I hope folks who are participating in the webinar got a lot out of it. I think they really did. And a reminder that we've got a couple more of these webinars or questions that we didn't answer, for example, around how to engage community and how to convince folks that community needs to be engaged. That will be the topic of Part 3 on January 9th. Fostering community partnerships. And so please sign up for that if you haven't already. And with that, I think we're going to close the webinar. And thanks again, everybody, for participating.